So in this video, we're going to continue and end our discussion in cardiovascular integration with a complicated topic of hemorrhage. In the last two videos, we talked about changes in gravitational force and what would happen when we are supine than standing. The second video, we talked about exercise and what happens with them. Now we're going to end with hemorrhage, which is a little bigger topic, but let's define hemorrhage first. Hemorrhage is the loss of blood, and bleeding can be due to either some bleeding inside or internal bleeding, or can be outside, which is external bleeding. And bleeding may occur due to some kind of leak from blood vessels or organs, or like contusion or injury. Commonly is, I have this picture of the brain, and not commonly, or like one of the dangerous things is having hemorrhage in the brain, because blood is not the brain's friend. We don't have blood in our brain. So let's talk about the compensatory responses to hemorrhage. So hemorrhage, let's just get it clear in our mind. That means we just lost blood volume, and we need to. So that means we have decreased arterial pressure, and that's bad. We need to increase the arterial pressure. So how are we going to do that? There's compensatory mechanisms that our body thankfully have developed, and I have them listed here. We'll start with number 1, which is a decrease in blood volume. Okay. And that produces a decrease in mean systemic pressure. As a result, there is a decrease in both cardiac output, as I listed here, and also decreased in arterial pressure. So hemorrhage equal decreased cardiac output and arterial pressure, and definitely decreased blood volume. Moving on, the carotid sinus baroreceptors, they detect the decrease in arterial pressure, okay? And as a result of the baroreceptor reflex, there is an increased sympathetic outflow to the heart and blood vessels. So this is the compensation, increasing sympathetic outflow to the heart and the blood vessels, and now we need to decrease the parasympathetic outflow to the heart. Okay, what does this produce? Again, this has been discussed over and over and over, and this produces the heart rate, contractility, total peripheral resistance, and total peripheral resistance. Why is it increasing? The answer is it's due to arteriolar constriction. Also, what we have with this increase in sympathetic and decrease in parasympathetic is we have venoconstriction, and that increases venous return. The constriction of the arterioles in the skeletal splanchnic and cutaneous vascular beds, we have that happening there. So we have constrictions in the skeletal splanchnics and cutaneous vascular beds. However, it doesn't occur in the coronaries, okay, or the cerebral vascular bed, okay, and this ensures that the adequate blood flow will be maintained to the heart and brain. Okay, we can't do constriction there, because we need blood to our heart so that the heart can work and provide for the rest of the body, and we need more blood to the brain. So thankfully, this is the system how it works. The last point under here, the carotid sinus baroreceptor, is that these responses, they attempt to restore normal arterial pressure. So now we have low blood pressure. What have we done? We increase heart rate, contractility, total peripheral resistance. We venoconstricted, and we constricted certain arterioles and not others. Okay, and we're going to summarize that in a figure. Now the third point here with hemorrhage is that chemoreceptors in the carotid and the aortic bodies, they are very, very sensitive to hypoxia. And they supplement the baroreceptor mechanism, which we just talked about, by increasing sympathetic outflow to the heart and blood vessels. So this point here of chemoreceptors, they kind of the friends of baroreceptors, they kind of try to do and help the baroreceptors with its job. Number 4 is a cerebral ischemia. If that happens in the brain, if we have ischemia, then that can cause increase in PCO2. What's going to happen when we have increase in PCO2? This activates chemoreceptors in the vasomotor centers, and what does that do? It increases sympathetic outflow. Moving on to number 5, which is another thing that we need to consider in hemorrhage, is arterial vasoconstriction. When we vasoconstrict the arteriole, we expect a decrease in the hydrostatic pressure, or the PC, as I've written here. Okay, a decrease in PC, and as a result of that happening, capillary absorption is favored, which helps to restore circulating blood volume. We can't afford to lose more blood. Now, the last point here is number 6, is the adrenal medulla. It releases epinephrine, okay, and norepinephrine. And why is that important? These supplement the action of the sympathetic nervous system on the heart and the blood vessels. Again, we need to be in sympathetic. We have hemorrhage, we need to be on fight or flight in order to save ourselves, or save our body, or save the patient who is having hemorrhage. Okay? Now, the point here about the RAS, which is renin-angiotensin-aldosterone system, which I talked about in a video on its own. Just a quick thing, what's happening in hemorrhage is it's activated. And why is it activated? It's activated because of the decrease in renal perfusion pressure. Okay, because angiotensin 2 is a potent vasoconstrictor, as we learned. It reinforces the stimulatory effect of the sympathetic nervous system on the total peripheral resistance. Okay, and aldosterone, okay, which is part of this RAS system, increases sodium chloride reabsorption in the kidney, and that therefore increases the circulating blood volume. Finally, in the last point here, we want to mention about the hemorrhage is the ADH antidiuretic hormone, which is released when arterial receptors. When these arterial receptors detect the decrease in blood volume, what happens? ADH causes vasoconstriction and increases water reabsorption, and that both tend to increase blood pressure. So let's sum up this in a figure, which I like figures. And here we have a hemorrhage, we have a decrease in arterial pressure, we have something, the baroreceptor reflex, and we also have renin, and then decrease in hydrostatic pressure. When we have a low arterial pressure due to hemorrhage, the baroreceptor reflex increases the sympathetic outflow, which does increasing heart rate, increases contractility, and does constriction of the arterioles, which we've seen also in exercise and other mechanisms, and that increases total peripheral resistance. We have a constriction of the veins, and that leads to increased venous return. And all these of the sympathetic outflow due to the baroreceptor reflex increases the arterial pressure. We have also the renin system, which when we have it increasing due to low perfusion of the kidney, we have increase in angiotensin 2. That leads to increase in total peripheral resistance. And we also have increase in aldosterone, which leads to a sodium reabsorption increase. Therefore, blood volume increases, and that thankfully increases arterial pressure. Finally, when we have the system is developed decrease in hydrostatic pressure in the capillary, which increases fluid absorption, therefore increases blood volume. And this sums it up in a nice table here. We have compensatory response due to a hemorrhage, heart rate increases, contractility increases, total peripheral resistance increases, venoconstriction, renin, angiotensin 2, aldosterone, epinephrine, norepinephrine, antidiuretic hormone will all increase. Thank you for listening to this video, watching this video. I appreciate your feedback.